Hi, today we have an interview session with the PT Foundation Acting CEO at the new launching of the LEVI8 Malaysia Physical Center. Welcome to the launching of LEVI8 Malaysia Physical Center. And then, as a acting president of PT Foundation, have a long history of social service initiative. Can you tell me what motivated you to do this job, and then what the progress of PT Foundation?
Okay. So first of all, congratulations to LEVI8 on this launch.
Yes.
We have been working with Ben and the setup of LEVI8 for a couple of years now. You see that you now have your own space. It's quite amazing. And for you to be helping our team, it's very nice of you to do so. Thank you.
Thank you.
But to the question of Pink Triangle, it's a very long story, but I'll try to keep it short. So Pink Triangle was started off even before 1987. Our year of registration is 1987. But before that, it started out with a team of people coming together to want to do good for the community. So at that time, there is no internet, there is very little resources available, and there was a lot of misinformation. Stigma and discrimination was widespread as well, particularly on issues around LGBT, on about being gay. People were very confused about how to deal with their same-sex attraction. They don't know that there is possibility of having relationships, of meeting other people. So we set up the organization to provide counseling support for them, so that they at least don't feel alone, that they have someone to talk to. So we did a telephone counseling line, and in our telephone counseling line, it's all done by volunteers who are trained in the art of para counseling. So that was how we got off. But in 1986, the first case of HIV came to Malaysia.
First case of HIV come to Malaysia.
So that really got us. I mean, we all know that's happening in the West, but we thought, oh, that's happening only in the West. But when they first got a case here, and eventually it really, if you see the HIV cases, it just exponential rise.
Rise.
So, and there was no other services in Malaysia for people to ask questions. There were no NGOs. The Ministry of Health were also not prepared on this.
And everyone was as panicked as just like when we get the COVID-19.
Right, yeah. So everyone here lived through COVID-19, and you know how kind of panic mode it was. That's how it was with HIV as well. Bear in mind at that time there was very little known about how HIV is transmitted, let alone whether there's any. At that time there was zero treatment, no treatment. That means if you get HIV, it's a question of time before you die. So that's why they say HIV is a death sentence.
Yes, they actually go through complications
their immune system breaks down, and then they get in and out of hospital. They get all kind of opportunistic infection. Eventually, they die from all the infections that they get,
like pneumonia, lung disease.
So when this happened in Malaysia, we pivoted from just providing LGBT counseling to also handle HIV and AIDS. So that's when we had telephone counseling line to provide accurate information for people. But that wasn't enough by itself, because we are getting a lot of calls on hospitals, wards, whereby people with HIV were there. They were not getting, their families have disowned them, or they are very demotivated, they are depression. So we have our trained volunteers to go and visit them as well. We call them our angels. They went there, even though we know that there's no cure, but there is no treatment, but we're there to hold their hands, to actually provide that empathy and that dignity, so they can die with dignity. So that's how we went through the HIV/AIDS, right? That was all in the 1990s, and by that time, we were not just working with gay men as well, but working with drug users, working with
sex
workers, providing the similar services, because HIV, by that time, they know it wasn't just a gay disease. It affected anybody who had risky behavior.
So
we basically focus on population to risky behavior and help out whatever we can.
I see.
So we were the first to go to the back lanes of childcare to provide clean needles, or rather teach our people how to clean their needles. And then we worked together with other NGOs to lobby for the government to provide clean needles. Because by that time in Malaysia, it was very clear that it wasn't homosexuals that were mostly infected, it was drug users.
Drug users.
This is in the early first 20 years of HIV. Today is very different. Today is mostly gay men and sexual transmission. In the early days, it was drug users. So we branched off our services to provide for all these people. And that's when we started to provide HIV testing as well. So in the old days, HIV testing was done by doctors only, right? So we got the doctors to train us, and we did the testing ourselves when rapid test kits became available. So we went around, test as many people as we can, and then link them up to medical service if they're positive, right? And it was only much later that prevention was available. So for a long time, we have to encourage people to use condom and lubricant. But around 2005 onwards, the world started to know about there is PrEP, pre-exposure prophylaxis.
Like what you're wearing in your t-shirt?
So this t-shirt here is what we do. All our outreach workers wear that. To encourage, especially for gay men, if you are sexually active and you're not using condom, you should really go on PrEP. It is highly effective. You take PrEP 1 pill a day, you will not get HIV. Even though you get exposed to it, you will not get it. So it's come a long way, from those early days when it's a death sentence. Today, HIV is a chronic disease. There is treatment available, and the best of all, it's free now. Those days, we have to pay up to 3,000 ringgit a month just for treatment, right? Now it's free, and even PrEP services, the government is providing selected government clinics, and it's free as well. So now our task is to really get people to come to testing, get people to use PrEP, and the main thing, of course, is still stigma discrimination. We got to tear down stigma discrimination as much as possible.
Mr. Raymond, in the last 20 years, right, we see a big trend of Malaysians going to try and are actually addicted to chem, like say the meth use. So they're combining the addiction of meth and sex. And then we have seen that more and more people, right, are actually addicted to chemsex and causing them to use unprotected sex. And then what do you foresee the value of the kind of service LEVI8 offer here, and how individual can use this service, right, to who wish to quit drugs or to do harm reduction?
Yeah, so it is definitely a phenomenon that is really bringing a lot of risky behavior, and that's driving the HIV infection among gay men in Malaysia. And you see that on all the dating apps, Grindr, everything, is rampant, right? So while our organization focus on the healthcare aspects, from everything from testing to treatment for both not just HIV but also for STIs,
which is a core work also. Then
those are
very
the
important.
community clinic to do all that. But it's very much focused on the healthcare components of it. So
physical component.
We started to also include the mental health component about 5 years ago. And we have trained counselors, trained psychologists to do that. But for people who are really dependent on ice and are engaging in risky behavior, including chemsex, there need to be more services for them, right?
Mental health counseling.
Mental health counseling, yes. A lot of therapy programs, right? So we would always look at the clients to see what stage that they're on. Many of them, many people who use ice don't need any care or support. They are just recreational users, and they function well. They control their intake every day, so they're fine. But sometimes they come towards the mental health or HIV testing
when they cross the borderline.
But there are many others whose dependence on ice become quite heavy, and then it becomes addictive, and that's when it becomes an issue.
We can see that the key populations of the LGBTQ, right, is very rampant on using the chemsex. Why is it happening?
I think
is it because of loneliness
it's
or
a myriad of other issues, a lot of underlying issues. there is a lot of peer pressure.
Peer pressure.
I think the problem is that if all your peers are using it, if you don't use, you are kind of like left out. Especially for younger men, they're kind of like influenced by their elder peers to
In
use
the
it as well.
in the apps, do they encourage the younger people to use? Do you
Yeah,
see
because
this
they were
happening?
sort of saying, if you're in the camp fund, then contact. If you're not in camp fund, then I'm not interested in even talk to you. Right? So there is that. But there are also more underlying issues. There's so many gay men face a lot of stigma and discrimination in their early life, in their childhood lives and everything. And when they start to explore the gay life, it's almost like a free license to do everything. Suddenly, the whole emotion, the freedom is there, and some of the freedom is to also take substance use.
Substance use.
We don't put a judgment on substance use, right? So that is purely up to the individual about that one, right? And if you're able to do it and you're functional, that's no issue. But where we get people coming to us is that sometimes they cannot handle it by themselves anymore.
They got mental health issues like psychosis.
They start to lose their job, lose their family, they start to having financial problems. So that's when it becomes an issue. So when they come to us, we can deal with the other issues around self-esteem, around depression, around anxiety. But when it comes to someone who's really dependent on us, especially for the purpose of sex, that's when we need more specialized help, right? So we work with a series of partners, government therapy sessions, private therapy, including our own. We have our own psychologists and that sort of thing. But we don't really have a program that provides somebody who wants to quit us to come forward, who wants to get out of the chemsex habit. How do they do it? So that's where I think LEVI can really come.
There's a way that maybe we can.
Service, but those who really are ready to seriously consider giving up, I think LEVI will be a very good option that we can refer our clients to you.
Yep. In fact, looking forward, right? I really wish that PT Foundations can work in collaboration together with LEVI to help those people who are facing mental health issues that due to overuse and abuse of camp fund. Okay. Last but not the least, what are the hopes and vision for the future of LEVI? What do you see?
I think it's going in the right direction. So you have, I think, built up quite a bit of experience over the years. You have this whole network of other NGOs, and we're working together. So I'm hoping that there is now a more comprehensive services available. We cannot work in isolation. We need to work together. We form a network.
Yes, network
because clients come to us, they present themselves with different issues. So not all would need just to come to our healthcare clinic. Not all would need to come to LEVI, but in between them, there are other services available.
Yes.
So that's be great to work together and provide a network of support and services.
Thank you for coming for this interview session, and thank you for coming the launching of LEVI8 Malaysia. So, shall you have any question for Mr. Raymond? Please write your in the comment, and then please subscribe, share, and like. Thank you.